Did you know that Knutson Technique requires 4 separate visits to be effective? Even if you miss one, you are doing it wrong. So, hi, this is Dr. Smiley, and welcome back to the part 2 of our fluoride series. Today, we are focusing on the clinical workhouse, which is the 2% sodium fluoride. So, in this lecture, I am going to show you how exactly the sodium fluoride solution is prepared, why its neutral pH matters, what is its mechanism of action, and a step by step guide to mastering the Knutson technique. So, let's begin. So, before starting the lecture, we need to know what are the questions that are asked in this topic. Okay, so in sodium fluoride, there are a variety of questions that you will be asked in pedo. The most important of which is they'll ask you classify the topical fluorides and write in detail about the Knutson technique or the application of sodium fluoride. Also, they can ask you short questions like Knutson technique or sodium fluoride. Also, it is one of the most important viva question. So, the neutral sodium fluoride is a type of professionally applied fluoride, which is a topical fluoride. Okay, so now neutral sodium fluoride, as discussed in the last lecture, these professionally applied fluoride provides high concentration of fluoride over a short period of time. Okay, so neutral sodium fluoride is a professionally applied fluoride, which is a topical fluoride. In this lecture, we are going to study about the sodium fluoride, what it is, what is the pH, what is the fluoride concentration of it. Then we are going to study how do we prepare sodium fluoride. Then we are going to see a step-by-step guide on what is the technique of application of sodium fluoride, also known as the Knutson technique. It is a very important question, very important viva question, very important PYQ. What is Knutson technique? It is a step-by-step guide for the application of sodium fluoride. Then we are going to study about the mechanism of action of sodium fluoride, its advantages and its disadvantages. So beginning with the introduction, now Knutson and Feldman were the ones who recommended the use of sodium fluoride for preventing dental caries. Okay, for preventing dental caries. Now what did they recommend? They recommended a technique of application. How many applications? 4 applications. So they recommended a technique of 4 applications of 2% of sodium fluoride. What was the concentration? 2%. 4 application of 2% of sodium fluoride at weekly intervals in 1 year. Okay, to make it easier for you, in 1 year there has to be 4 applications of what? Of 2% sodium fluoride. And at what intervals? At weekly intervals. Okay, so in 1 year you are going to apply the sodium fluoride 4 times at weekly intervals. Okay, and at what ages? At what ages we are going to do that? At 3, 7, 11 and 13 years. I hope we are clear. Once again, I'll explain it to you. In 1 year, okay, for example, at the age of 3 years, you are going to apply 2% of sodium fluoride. How many times? 4 times. And at what intervals? Weekly intervals. For example, on Sunday, if you apply sodium fluoride, then next Sunday you are going to apply sodium fluoride, then next Sunday, then next Sunday. Okay, at what ages? At the age of 3, 7, 11 and 13 years. Moving forward, what is the pH of sodium fluoride? It has a neutral pH, means the pH is 7. And what is the fluoride concentration of it? It is 9200 ppm. And on the application of sodium fluoride, what is the rate of caries reduction? Okay, in the first year, the caries reduction was seen as 45%, and in the second year, it was seen as 36%. Okay, so with this, we come to the end of the introduction. In introduction, you have to remember that Knutson and Feldman recommended a technique in which there is 4 application of 2% of sodium fluoride at a weekly interval. Okay, and at what ages? At the ages of 3, 7, 11 and 13, right? So moving forward, we have methods of preparation of sodium fluoride. Now, how do we prepare sodium fluoride? We take 20 gram of sodium fluoride powder and 1 liter of distilled water in a plastic bottle. So we add both of these ingredients in a plastic bottle and 2% of sodium fluoride solution is formed. So how do we say it? We say it as about 2% of sodium fluoride solution can be prepared by dissolving 20 gram of sodium fluoride powder in 1 liter of distilled water in a plastic bottle. Now, it is important to understand why in a plastic bottle, why not a glass bottle? So, this is an important Viva question that you might get. What happens when we prepare the sodium fluoride in a glass bottle? The fluoride ions react with the silica of glass and silicon difluoride is formed. Therefore, the fluoride ions gets consumed to form the silicon difluoride, and therefore no free active fluoride is available for the anticarriers action. So basically, if we store sodium fluoride in glass bottles or glass containers, the effectiveness of sodium fluoride decreases. Therefore, it's always stored in a plastic bottle and not in glass bottles. Moving forward, now we have the Knutson technique. Knutson technique is basically a step-by-step guide. Okay, it is a step-by-step guide for the application of sodium fluoride. How do you apply sodium fluoride? So the application technique of sodium fluoride or the Knutson technique is one and the same thing. What is the armamentarium which we will require? We'll require sodium fluoride and will require the applicator tips for the Knutson technique. Let's see how it's done. So, what do we do? Before starting the application, we do cleaning and polishing of the teeth. We clean all the teeth, we remove all the debris, we polish the teeth surfaces. Then the second step is isolation. Okay, so all the quadrants are isolated with cotton rolls, and then what do? We do the drying of teeth. So the first step was cleaning and polishing. The second step is isolation and drying. Isolation with what? Cotton rolls. Okay, and then the sodium fluoride is applied with the cotton applicator on one quadrant. So we do not apply sodium fluoride on all the quadrant at once. What do? We take the sodium fluoride, we take the cotton applicator and we apply it on one quadrant at one time. Then we let the sodium fluoride dry on the teeth for how many minutes? 4 minutes. Okay, and then the procedure is repeated for rest of the quadrants. Then the patient is given certain instruction. What are those instructions? The patient is told not to eat anything or drink anything or not to rinse for how many minutes? 30 minutes. Not to rinse for 30 minutes. Why do we do that? We do that so that the availability of fluoride ion is prolonged. Okay. And the same process is repeated on second, third and fourth application, which are given weekly apart at the ages of 3, 7, 11 and 13 years of age. So let's summarize it. First we do the cleaning and polishing of the teeth. Then we do the isolation and drying of the teeth. Then we take the sodium fluoride solution and the cotton applicator and then apply it on one quadrant. Then we let it dry for how many minutes? 4 minutes. Then the procedure is repeated on the remaining quadrant. Also the patient is instructed not to eat, drink or rinse for 30 minutes. And then this entire procedure is going to be repeated on the second, third and fourth application. Now when are these applications? Which are weekly apart. These applications are going to be weekly apart. Okay, so we are going to give 4 applications weekly apart at what ages? 3, 7, 11 and 13 years. Moving forward, we have the mechanism of action of sodium fluoride. So what happens? When sodium fluoride is applied topically, it reacts with the hydroxyapatite crystals of the enamel and calcium fluoride is formed. This calcium fluoride is a dominant product of the reaction. So this sodium fluoride keeps on reacting with the hydroxyapatite crystals continuously and calcium fluoride keeps on getting formed. But at a point, choking off effect occurs. Now what is this choking off effect? This choking off effect mainly occurs because there is a formation of thick layer of calcium fluoride on the tooth. Okay, now it interferes with the further diffusion of the fluoride from the sodium fluoride solution to react with hydroxyapatite crystal. For example, consider this as a tooth and this as sodium fluoride. Consider this as tooth Consider this as tooth and this as sodium fluoride. Now the layer which you see in green is basically the calcium fluoride. This calcium fluoride gets formed all around the tooth and thereby prevents the interaction between the sodium fluoride and the hydroxyapatite crystals of the tooth. This is known as the choking off effect. Now, moving forward, we saw that the fluoride ions react with hydroxyapatite crystals to form the calcium fluoride. Now, this calcium fluoride reacts further with the hydroxyapatite crystals to form the fluoridated hydroxyapatite. Now, this fluoridated hydroxyapatite increases the concentration of the surface fluoride. And what happens when the concentration of fluoride is increased? As we know, we learned this in our first lecture, which is fundamental of fluoride, where we saw the mechanism of action of fluoride. So what happens when fluoridated hydroxyapatite crystals are formed? The tooth structure becomes more stable. Okay, there is less susceptibility to dissolution by acid, which means there is decreased demineralization. Then it interferes with the plaque metabolism through anti-enzymatic action, and then it helps in remineralization of the initial decalcified areas. We have seen this in the mechanism of action of fluoride. There were 5 actions that the fluoride does. The first one is to reduce the demineralization. The second one is to increase the mineralization. The third one is the remineralization of initial decalcified lesion or incipient lesion. The fourth one is that it interferes with plaque microorganisms activity, and the fifth one, it helps in modification of the tooth morphology. Okay, so you can write all these 5 factors here. Moving forward, what are the advantages of the sodium fluoride? So the sodium fluoride is chemically stable, it has an acceptable taste, it is non-irritating to the gingival tissue, it does not discolor the teeth, and it is cheap and inexpensive. So it's affordable, it's non-irritating, it's stable, it does not discolor the teeth, so it has overall good properties to be used. But one of the major disadvantage of using it is that it has to be kept applied for 4 minutes, continuous application for 4 minutes. So here the child has to be very cooperative and a very good behavior management has to be done. Second is the patient has to make 4 visits in a short period of time. So again, patient cooperation, patient compliance is a must. And then the follow-ups are very difficult, right? Patient does not turn up at the given time and the given day. So these are the major disadvantages in sodium fluoride application. Apart from that, there are other fluoride applications like APF and fluoride varnishes, which have better property than sodium fluoride. Okay. So with this, we come to the end of the lecture and it's a quiz time. So, what is the primary anti-caries mechanism of sodium fluoride in topical dental products? Is it neutralizing bacterial acids in the saliva? Or is it killing all cariogenic bacteria on contact? Or is it forming fluorapatite, which reduces enamel solubility and enhances remineralization? Or is it creating a physical barrier on the tooth surface to prevent plaque accumulation? Yes, you are right. It is forming fluorapatite, which reduces the enamel solubility and enhances the remineralization. Now, the next question is for you to answer in the comment box. When preparing a 2% sodium fluoride solution for professional application, which statement is incorrect? Please read the question properly. Which statement is incorrect? Okay. Option A, it is recommended as a caries preventive agent. Option B, the solution should be ideally stored in a plastic bottle. Option C, storing it in a glass bottle is acceptable as fluoride does not react with silica. Option D, if stored in glass, fluoride ions react with silica, reducing the availability of active fluoride. Let me know your answers in the comment box. So with this, we come to the end of our lecture. While sodium fluoride may seem old school with its 4-week cycle, it remains a fundamental protocol every dental student must master for clinical exams. But what if, what if you could achieve a faster, more intense fluoride uptake in just one visit? That's where APF changed the game. But be careful, if you use it on the wrong patient, you could ruin their expensive aesthetic restorations. So, in the next video, we are going to break down the Brodewald technique and the acid power of APF. Hit the like button if this simplified the Knutson technique for you, and in the description box you will get a link to the next video of the fluoride series, which is APF gels and solutions. I'll see you there. Till then, goodbye.